Hi, I'm Dr. John Storment. I'm the Medical Director of Fertility Answers. I'm a reproductive endocrinologist who specialize in taking care of patients who are trying to conceive and are patients with recurrent miscarriages. We've had a lot of patients inquire about the safety and efficacy of the corona vaccine for just those patients who are trying to conceive or who are early in their pregnancy. Vaccine hesitancy is very common. I understand why you might be reluctant to get a vaccine. We in the medical community tend to change our minds at times. I understand that. This is good for you, now it's not good for you. You don't want to make a mistake in something as important as a pregnancy or the health of your baby. One of the questions that I got from a patient is that she was very frustrated because her doctor said, well, it's just up to you. It's going to be a personal decision. That wasn't really enough to help her make that decision to know if it was best for her and her pregnancy. So hopefully this information that I give to you today will be helpful in you guys making your decision on whether the vaccine is best for you. One of the questions that I get often is, was a vaccine studied well enough? Was it rushed out to the public too quickly? The Emergency Use Authorization Act allowed us to get it out quicker, but it did not jeopardize or compromise the science. The same rigorous studies that went into the COVID vaccine research went into every other vaccine research that we've ever had. It was just simply getting out quicker, getting rid of the red tape to allow us to get there quicker. The studies were all done very well and very rigorous, and no steps were ever skipped in getting it to delivery and making sure that it was safe. One of the most common questions I get is the COVID vaccine safe in pregnancy, in lactating women, and in patients trying to conceive? In short, yes. We now have data in over 70,000 women who were pregnant and delivered that the pregnancy was not compromised, delivery was not compromised, and it was completely safe. Does the COVID vaccine impair fertility? In short, no. The reason why there was a fear that it might is because of the characteristic spike protein on the surface of the coronavirus. This is how the vaccine works. It causes our body to make antibodies against the spike protein of the coronavirus. When patients found out, or when people learn that there are also spike proteins in the placenta, they automatically assume that, oh, well, if it's impacting the spike proteins of the coronavirus, it's also going to impact the placenta. In fact, two different structures. It's just a generic term of spike proteins. We have spike proteins throughout our body, and the coronavirus vaccine only attacks the spike protein on the coronavirus, not anywhere else. It has no impact on the placenta, no impact on the pregnancy, and does not decrease your fertility. We know that when you make your decision on whether or not to get the vaccine or not, you have to weigh the risk and benefits. So the next question is this: what's the harm in me getting COVID? I'm a young, healthy person, so what if I get pregnant? In fact, pregnancy is considered an immunocompromised state of sorts. Patients who get pregnant and get coronavirus have a higher incidence of ICU hospitalization, have a higher incidence of death, have a higher incidence of being intubated. And those are not just scare tactics to get you to get a vaccine. We know that these risks in pregnancy are real. We want you to have a healthy pregnancy. I strongly encourage patients to consider the vaccine who are trying to get pregnant and who are pregnant and who are lactating, because we know it doesn't harm the baby, and we know that it might help overall decrease the incidence of this disease. Bottom line, pregnant patients, lactating patients, and patients trying to conceive should seriously consider getting the coronavirus vaccine. The vaccine is safe for you and your child.